back on what Jim talked about with ergonomics, because that's where it all starts. I'm going to talk today about posture a little bit more. And we all know to have orthotics in our shoes, and we have sore feet, or we all know we spend a lot of time in our bed, so we want a bed that's supportive and comfortable at the same time. And so the same thing goes with our workstation. We're there all day. We live at our workstation, so we want something that supports proper posture. There you go. And so, again, my name is Dr. Savara, and I'm a chiropractor. One of the things that I do all day is look at posture and analyze posture, and you're welcome, and offer advice on posture. And I do see a lot of people that come into the office, they work at a workstation, definitely in this area. And I can tell, based on someone's posture, most of the time what they do for a living. And so when we're sitting at our desk, we develop what's called upper cross posture or forward head posture. This is a posture that I'm going to focus on today. And this is extremely important because on the first handout that I gave there on the front page, back pain accounts for millions of dollars lost each year in productivity. It's the number 5 most common reason for doctor visits in the U.S., MD chiropractic visits. In the U.S., and it's not necessarily an older population, it's a younger population, and it's due to the cumulative effect of sitting at the office. So there's a law in physics that says structure and function are interrelated, and when you alter the structure of an object, you also alter the way that object moves or functions, which is why you can't ride the bike when the tire is crooked. The same thing goes for our frame. We're creatures of repetition, so we do the same thing every day, and our body adapts to that. It's one of the windows to our spine is our posture. So we can start to develop a forward head because we're looking at the monitor a lot. And then we combine that with rounded shoulders here. And this is what's considered the upper cross posture. And this puts tremendous stress on the structures of our spine, which include the joints, the ligaments, the muscles, and the tendons. And so over time, this creates that chronic discomfort in our neck, shoulders, back, and our extremities. So what I'd like to do today is really be hands-on today and ask for some brave souls to come up and demonstrate posture for everyone. And so this way we'll be more aware of it. And throughout that, I'll go ahead and discuss common findings that I see in the office from repetitive stress of sitting. So would anybody like to come up and demonstrate posture? Would you? All right, that'd be great. Thanks for coming up. Your name?
George.
George? All right, George. So the first thing we're going to do is we're going to go ahead and we'll set up for the camera too. So we'll face this way right here.
Okay.
All right, so go ahead and stand this way here.
Yeah.
So just like where I'm at here,
Yeah.
facing that way.
Oh.
Go ahead and turn like that.
Yeah.
Perfect. Go ahead and close your eyes. Take a couple steps in place. Just kind of get relaxed. Go ahead and march in place.
March in place. 1, 2.
Or come back here. Yeah. And just stay right where you're at, just kind of march in place.
Oh, I see what you're saying.
Yep, there you go.
Okay.
All right, nice and relaxed, okay?
Okay.
There you go. Go ahead and stop. You can open your eyes, look straight ahead.
Okay.
So the first thing we want to look for is that forward head posture. We want the earlobes, and it'd be great if you came up next because the earrings, you can really see that with the posture. So we want the earlobes to line up right at the little bump on the outside of our shoulder. So we want that to be nice and even. So when George's looking ahead, you can see you have a really good eye on this. What would you say the earlobe is in relation to the shoulder? You say it's in front of it, or a little bit in front? Okay. The second thing we want to look for is any dropping and rounding of the shoulders here as opposed to back like this. And there is sorry, keep calling me out here. All right. So, and there's a little bit of rounding of the shoulders going forward. So this is basically what I was describing as upper cross posture. Extremely common. I see it every day from the workplace. So because of the structures here, there's muscles that cross from the mid-back up into the neck, and it puts stress on these muscles every day throughout the day. So that's what becomes really tight and tender. So our head weighs about 10 to 12 pounds, some more than others. And it's all rested right on the spine. Everything's happy. It's just the weight is distributed through the spine. And every inch that our head moves forward of where it should be on the shoulder, it increases the weight of the head by 10 pounds. So our head can weigh 10, 20, 20, 30, even 40 pounds due to this weight distribution. And it doesn't we lose that biomechanical advantage that I was talking about because the only way to hold the head up now is for the muscles in the back of the neck and the upper back to hold the head up to look at the monitor. So that puts tremendous stress on those structures back there. And we tend to lose the curve in our neck when our head goes forward here. I see it a lot when I take x-rays. Instead of having a nice curve, it becomes straighter. And I'll talk about this ergonomic pillow, how we can help with that in a little bit too. And one thing that we see with this posture is headaches. Tension headaches are extremely common. We don't know why we get them, but we get them often. They can be mild to moderate. They're very frequent. And we have what's called suboccipital muscles here. And these are the muscles that hold our head up like this to look at the monitor. And when those muscles get really tight, they give the symptoms and the presentation of headaches. And we can take medication, we do it over and over again, but until we address the actual cause, we're going to get those headaches. So that we want to bring the head back. So one thing I do in the car, because it looks funny, nobody's really seeing, but you bring your head back like this. And you do this 15 times like that. You just hold. I'm telling you, pretty soon you're going to look over and you're going to see people doing this. I'm telling everybody to do this. So, because everything we do is out in front of us, right? So if we just bring it back, we train our muscles in our spine and our back to hold the chin back. And we can make changes in our spine. We see this with pre and post x-rays, so we can make changes. So we're going to do that. The second thing with the rounded shoulders is that when we're in front typing all day, our chest, which attaches to our shoulders here, they get really tight, and they're going to pull the shoulders rounded like this. So we spend too much time here. And so what happens now in the back, the rhomboids, the levator scap muscle here, all these posterior muscles in the shoulder as well are going to lose. It's like a battle going on each day between, these are considered postural muscles, so they're trying to maintain your posture here. When we work here, they're trying to hold back, but they lose the battle to what we do every day at the seat. So what happens is you get trigger points. Those muscles ball up, they get tender, tight, you get a massage, you go, oh, that's the spot right there, those are tight. They actually weaken though, they're not stronger, so they're weaker. So they allow that chest to pull forward. So now we have this forward head and rounded shoulders like this, and we can get some headaches associated. So again, ergonomics is the first step in all of this. So I'm going to talk about how to offset this. We already talked about the car, or anytime bringing it back like this. Yeah, the rooster. That's a good. I'm gonna start using that if you don't mind. The second one, when we're in the gym, we do a lot of. Sometimes guys will do a lot of mirror muscles. We'll work our chest and just create it even tighter. But what we want to do is open the chest up. We want to stretch the chest. So to do that, you can do it perfect like a doorway stretch. You can walk into the door like this, and you just hold for 60 seconds. That's going to stretch the chest, allow it to come back a little bit more. And this stick that I brought in is a simple tool to help with shoulder flexibility and back. And you just hold it like this. And you can do different degrees. That's going to open up the chest, open up the shoulders like this. And again, I'm not promoting taking breaks at the computer often, but when you do take your breaks, this is a great time to do it. Bring it back here and just hold. Do the doorway stretch, one arm at a time or both, 60 seconds. That'll make a huge difference if you do that once or twice a day. The second thing we want to do is we want to strengthen these rhomboid muscles. So when you're in the gym, the row machines are fantastic, where you put your feet in the front, you grab the handle, and you just start doing rows. And that's going to strengthen those postural muscles, maintain the shoulders going back. And you can also do bent over rows, which is bending over with the weight and just doing this. Anything where you bring the scapula back. You can also use bands and tie them around a doorknob. Tie the middle around the doorknob, grab both ends, and just do this with the bands. So that's really easy. And you don't even need bands. You can do it without weight. If you imagine you have weight in your hand and slowly retract the scapula and just work on firing those muscles in the back. That will strengthen them. So we got the roosters, we got the back strengthening, and the chest stretching. It's going to really offset that posture. And that brings us to, you can sit down. Thank you so much, George. Appreciate it. That brings us to the pillow. I really recommend one of these pillows. The best way to sleep is on our back for this posture. And like I was mentioning before, we tend to lose the curvature in our neck when our head goes forward. So one thing we can do is help maintain the proper curvature at night while we sleep by allowing this to give us that lordosis, it's called, or that curve in the neck. It drops our head in the middle. And this pillow in particular I like because you can sleep on your back, and when it's uncomfortable for most people to sleep like that all night, you can just turn to your side and you can sleep on the sides as well. But the purpose for this posture, a cervical pillow is what it's called. So you want one that they don't all have the sides. Some just have the bar in front here. It's called a cervical pillow. You can also roll up a towel, put rubber bands on each end, and just kind of hang over the edge of the bed just for a few minutes to help get that curve back into the neck. That's something else we can do there. Are there any questions so far with upper cross posture?
Well, I have a pillow, but it's not like that. It's got like a very slight curve. Not in the middle, but not in the middle like you have in the middle of the pillow, but it's at the edge.
Oh yeah? Is it for back sleeping?
Yes. It's also side sleeping, so it's nice. So when you like this, your shoulder, the curve fits in that shoulder, and the neck just goes on top.
Oh,
It's
perfect.
very comfortable.
That's perfect. I haven't really seen that though. That sounds really great though. The thing you want to keep in mind with side sleeping is to keep the nose in level with the spine. So when you're on your side, you're not like this, which kind of smashes your traps and upper back here. So when you wake up, it feels very stiff. You got to kind of stretch out. And you don't want it where the pillow is too thick, so you're sleeping like this all night.
Would you use that pillow for sleeping or no, just for this exercise?
Sleeping. Yep. This is something if you can get used to. If you, sleeping on your back, they measure the amount of pressure placed on our backs. Sleeping on our backs has the least amount of pressure, especially when you put something under your knees to lift up the knees a little bit. And a lot of us with, when we're discussing upper cross posture, we're going to want to maintain that curvature in the neck. So this is why I really recommend a pillow, a cervical pillow, to sleep at night. Help with that.
Where are those sold?
All over the place. Mattress stores, Bed Bath & Beyond, and places like that.
I was going to ask where you can buy that.
Oh yeah, you'll see them all over.
You call it circular pillow?
A cervical,
Oh,
like a
circular.
neck pillow, back sleeping neck pillow, yeah.
Oh, okay.
Yep. And you definitely don't want to sleep face down. That's the most comfortable. Maybe get comfortable when you get tired enough, turn back over, use one of these. Because you sleep like this, and if you imagine walking around for 7-8 hours a day, you walk into a ton of walls too, right? But you're definitely, once you, at the end of the day, you finally go like this, you're gonna have a lot of neck discomfort there. So again, it's not just one day of ergonomics, it's over time. And like I said, we can make changes. You see it every day. And these exercises really are what offset that upper cross posture. And would anybody else like to come up to take a look at posture? All right, perfect. Perfect, thanks for coming up. And your name? Hilda? All right, thanks Hilda. We're going to stand here again. Go ahead, march in place. Eyes closed, nice and relaxed. Okay, go ahead, stop. And open your eyes, so you're right there. Okay. Oh, look at that. So you can see really easily now with the earrings. They look like they're coming right down where they should in the part of the shoulder, anterior part of the shoulder. That's great. Shoulders appear back here and they're even with height as well. So do you work on this? The posture?
Yeah.
Yeah, I can see, because I noticed you raised your hand before. You spent a lot of time on the computer each day.
Yeah.
But the posture is maintained.
I try to.
All right. Yeah, and you stand up taller.
Because I had sciatic nerve, problems.
Okay.
So, I don't think I have posture.
Absolutely, yeah. It all starts at the feet, right? And works its way up. So thanks for coming up. That's great posture.
Okay.
Would anybody else like to come up and check it out? And if not, I can just take questions from here on out about this. All right. Well, I hope you enjoyed the hands-on approach there. If you have any questions, I'll be around for a little bit after this as well, and I'd love to answer some more.